Hello guys, this is Dr. Chinmay and you're watching Med Talks India, where we talk about interesting medical facts in simpler ways. Today we are going to discuss about a very common topic, that is hypertension or high blood pressure. Before proceeding further, I must request you to hit the like or dislike button as per your perception of the video, and don't forget to subscribe the channel to remain ahead in the world of health. So without wasting any more time, let's talk. Hypertension is a term which is derived from hyper, which means over or beyond, and tension, which means stretching or straining. In simple words, it is a situation of overstretching of the blood vessel walls. But many people think that hypertension is somehow related with psychological stress, which is also in layman terms called as tension. But this is a myth. Actually, psychological stress is a risk factor for hypertension, but it is not synonymous with it. There are many people who are having psychological stress without having any hypertension. Also, there are many people with hypertension, they don't have any kind of psychological stress. So, coming to the history of hypertension, the hypertension is a condition which is known to mankind since 2600 BC. It was termed earlier as hard pulse disease, and in those days only method of management of the condition were venesection or bleeding by leeches. Now, the concept behind this kind of management was, if there is increased stress on the wall of the blood vessels, then remove some amount of the blood and reduce the strain on the walls. This may sound horrific, but that is true. In 1913, Janeway came up with the term hypertensive vascular disease, which is vastly used till date because it covers almost all the aspects of this condition. It is only after 1950s, with the advent of the diuretic antihypertensive drugs, the new era of hypertension management began, and nowadays we have a bunch of drugs in our hand with rational use of which we can manage almost all the cases of hypertension. Now, before proceeding further, we must understand what is blood pressure and how it is measured. This is the instrument with which blood pressure is measured, which is called as sphygmomanometer. The blood pressure is nothing but the representation of the pressure on wall of the blood vessels at different situations of the heart. Now, we all know heart starts beating from intrauterine life and it will continue beating till the last breath of us. So, with each beat, heart constricts and then relaxes, then again constricts and relaxes. The constriction is also called as systole, relaxation is called as diastole. During constriction, the heart pushes the blood into the blood vessels. So it is very easy to understand that while it is pushing the blood into the blood vessels, the stress or the stretching force on the wall of the vessels is more. That's why systolic blood pressure is more. While during diastole, the heart pulls the blood from the blood vessels. That's why the stretching force is less. That's why diastolic blood pressure will be less. Now, there are various kind of sphygmomanometers. The one that is shown here is called as digital sphygmomanometer, which is available in the market and many people are purchasing these days for self-monitoring. But they should be cautious while purchasing this because this must be validated and this must be accurate one. The second one is also called as mercury sphygmomanometer, which is commonly used by the doctors to measure the pressure of the patients. And the third one is called as aneroid sphygmomanometer, which does not use any kind of liquid for measurement and it is rarely used nowadays. Now, the definition of the blood pressure is actually a very confusing condition because the blood pressure has been defined variously by different organizations. I have quoted most accepted ones here. First one is defined by the JNC or Joint National Congress 8 guidelines. This states that BP more than equal to 140/90 for people less than 60 years of age and more than 150/90 for people more than 60 years of age can be considered as hypertensive. WHO also defines blood pressure with similar terms. But American Heart Association, which is also a huge association, states that blood pressure level more than equal to 140 by 80 can be considered as stage 1 hypertension. More than equal to 140 by 90 is stage 2, and more than equal to 180 by 120 can be considered as hypertensive crisis. Now, main issue with blood pressure measurement is its accuracy, which unfortunately can be affected by multiple factors. So there are few instructions that the person must follow so that the blood pressure measurement will be accurate. First of all, the person must not smoke, exercise, drink any caffeinated beverages or alcohols within 30 minutes of the measurement. Then the person must rest in a chair for at least 5 minutes with the left arm resting comfortably on a flat surface at heart level and sit calmly without talking. Then make sure you are relaxed. Sit still in a chair with the feet flat on the floor with the back straight and well supported. Then place the bottom of the cuff above your bend of the elbow and don't take measurement over the clothes. Then use properly calibrated and validated instrument. Check the cuff size and fitting. Then take at least 2 measurements 1 minute apart in morning before taking medications and in the evening before dinner and record all the results. So that's all for today. In next video we will be discussing about the prevalence of this condition, the risk factors, the complications and how we can prevent and manage this. So till then, take care, be healthy and keep smiling. Thank you.